Hello, my name is Kevin Alschuler. I'm a psychologist in the Department of Rehabilitation Medicine at the University of Washington. I'm here to talk to you about the psychology of injury, rehabilitation, and recovery. As athletes, it's almost inevitable that at some point we'll confront some source of pain, some source of discomfort, or some type of injury that'll derail our pursuit of our athletic goals. My goal is to help you be able to work through those as effectively and efficiently as possible. I'm going to cover three separate areas today as part of this talk. First is going to be just a broad overview of the psychological perspective on pain, injury, and coping. Then we'll move into the sport-specific space where we consider not just our general understanding, but how it applies to sport. And finally, we'll talk about how we can use pain psychology to optimize or get the most from our rehabilitation and recovery. Let's start with the psychology of pain and injury. In general, we look at all medical problems at this point through what we call a biopsychosocial model. Biopsychosocial model includes biomedical and biological factors, so things like the severity of an injury we have, as well as things like how old we are or what sex we are. It also includes psychological factors, so things like our mood, anxiety, and how we're coping with the challenge that we're facing. And there's social factors, which is the intersection of the injury or the illness that we have with our relationships, our social, romantic, family relationships, and with the environment that surrounds us. There's over 40 years of research now on coping with pain and injury. And this research suggests that if we have an injury and that injury is painful, the impact of that pain, how much it hurts on our functioning or our quality of life, is only modest. It's not just how much it hurts. Just as big as how much it hurts is how we respond to that injury. In fact, there's research that suggests our response is more powerful than how bad it hurts. Think of it like a dimmer switch. We can increase or decrease how much that pain or that injury gets in the way based on how we handle the situation. Now, this isn't to say that we can wish it or will it all away, but it's saying that we can have a big impact on how much an injury affects us. When we think about how people cope with or handle pain or injury, we're often thinking in two areas broadly. One is our thoughts, so how we think about or understand our pain or our injury. And the second is behavior, so how we act in response to that pain or that injury. Now, some of our thoughts and some of our behaviors are what we call maladaptive. Maladaptive means that they're unhelpful. When we have our unhelpful thoughts, our unhelpful responses, our functioning goes down, our mood goes down, and our pain gets worse. Other thoughts and behaviors are what we call adaptive, or they're helpful. They help facilitate living well and functioning at our best despite the pain or injury. So what are some examples of this? So maladaptive thinking often starts from this belief that if I'm in pain, I can't function. And if I'm going to function, I need to get rid of the pain. So it's all about the pain and the pain being in the way. The most researched maladaptive coping approach is what we call catastrophizing. It's where we think of everything as a catastrophe. We roll our ankle and our mind goes to, what if I tore something and my season's over? right? We jump to that worst case scenario. Other maladaptive coping strategies focus on feeling out of control or helpless in a situation. They focus on needing to find a cure. I have to find a cure or I can't get past this. And they focus on the extent to which the pain the person's feeling means that they're harming their body. And we'll talk more about that later in terms of why that is or is not accurate. Adaptive thinking says, okay, if I have this pain, I can still focus on functioning. I can figure out how to function at my best despite the discomfort that I'm experiencing. We talk a lot about willingness. Willingness does not mean that a person likes having pain in their life, but it may mean that they're more open to it being there. They say, okay, I'm willing to accept the fact that I have pain, I have this injury. Now, what can I do about it? What can I do with this in my life? Adaptive copers are also very flexible. They're open to approaching life in new or different ways that can help accommodate for or work around the pain or injury that they have. Now, this might look like a lot here, but this actually provides a great explanation of what can happen when we have an injury. If you start at the top middle where it says injury, and we just focus on the right-hand side right now, you'll see that this is the group that generally does okay with an injury. They get injured, right? Let's go back to that sprained ankle. They twist their ankle. They experience the pain. It hurts. But they respond with relatively low fear. They say, oh man, that's not good, but I know what to do about this. I know I can help myself get better. They confront the challenge. They do their rehab. They recover. Things get better. Okay? That's our ideal circumstance. The left-hand side is where things get as messy as it looks. This person rolls their ankle. It hurts. The pain experience, it hurts. They decide that it must be something really bad. I broke my ankle or I tore a ligament. Okay, so they catastrophize. Think of that worst case scenario. They're more likely to catastrophize if they're already in a negative mind space, right? Have low mood, feel negatively about things, or if they get threatening illness information, meaning maybe somebody looks at their ankle and goes, oh boy, that doesn't look good, right? That pushes us out to that extreme. Then we get in this mess around fear of pain or pain anxiety. Okay? When we have pain, we're actively having pain. That's scary, right? It's something that is scary for us. It's an alarm going off. We are motivated to make it stop. So we try to escape from it. If walking hurts, we stop walking. If laying there hurts, we might take pain medication to make the pain go away. And we try to escape from feeling the pain. If it's something we anticipate happening, right? Yesterday I sprained my ankle. Now I'm waking up today and I'm realizing this might hurt. Right? We might avoid doing things out of fear of bringing it on. So rather than escaping from it currently happening, we might avoid, say, putting weight on our foot out of fear that it's going to hurt. When we do those things, right, we start doing less. So this gets into disuse or deconditioning. We start to get out of shape. Disability, we function at a lower level. And it's depressing, right? It's depressing to do less. When we get out of shape and we're not functioning well and we're in a worse mental state or emotional state, the next time we feel that pain, we are set up worse to handle it. And then we start going around the cycle again and again. Now that might look messy to you, but the flip side is that each of those spots is a spot where we can break out of that cycle. So there's an opportunity to think differently so we don't catastrophize as much. There's an opportunity to respond differently in the face of the pain. So respond differently around that fear of pain or pain anxiety or those escape and avoidance responses. There's opportunities to not get deconditioned, to keep accessing the things that are important to us so we don't hit that disuse, disability, and depression group. And then there's that opportunity through each of those to break out of the left-hand side, move over to the right, and move forward. So what are the sport-specific pieces that can go on top of what I've said so far? Well, there's many, but here's a few that I want to highlight that were part of some really important work done about 20 years ago on athletes, where the author said, the things we know for the general population also hold for sport, but we can add these extra pieces to how we're thinking about this. One is that athletes think very specifically and critically about their bodies, about how they're handling their injuries, about how they're recovering, right? In sport, our body is our vehicle. It's something we're very attuned to. It's important that we have a good awareness of how we're feeling. So there's a heightened awareness of the body piece. There's an emotional piece. So on one hand, sometimes it's almost a relief, right? We're training really hard for something. It's really hard. We get injured and it's almost a relief that we get to stop, at least initially. But we're also very invested in what we do. So we could be angry or frustrated. We might feel bored because we're not getting to do what we always did before. We might have grief or sadness around that sense of loss. Right? So there's a lot of emotions that can come up. And then there's the behavioral pieces, right? If you're injured and you're an athlete, you're more or less expected to rehab. So how well are you sticking to the rehab program? What are you avoiding doing? How distracted are you by the injury? Are you showing up at practice? Are you engaging with your teammates? There's so many pieces to how we act in response to our injury. Now, there's also some things we know about coping with pain and injury that's specific to sport. A lot has been made of the concept of pain tolerance, with pain tolerance essentially being how long we can stand being in pain or being uncomfortable. And athletes seem to be more tolerant of pain than non-athletes. We don't really know why. It might be that athletes just develop better coping skills and they can handle it. It might be that exercise actually helps reduce how much things hurt. And so by exercising, we're helping ourselves manage the discomfort. It could be learned tolerance, right? We learn that even though it hurts a lot and we feel like we want to stop, we know we can push through it because we've learned that lesson over time. Or it could be that athletes are a self-selected group, that people who are more tolerant of pain are more likely to go into sport. And so the group that we look at, the group of athletes, happen to be people who were already more tolerant of pain. So we don't really know. This is an area where we're trying to learn more. Our group has also looked at how people cope with pain and cope with discomfort in the context of sports. This shouldn't be surprising. On average, athletes use more of those adaptive or helpful coping skills than non-athletes. And probably not surprising for all the reasons we just talked about with pain tolerance. But even within the athlete group, there's variability. And we saw that those who use more adaptive skills and fewer maladaptive coping skills experience less interference from pain or discomfort that they have. And they're more likely to achieve important outcomes like finish a marathon or an ultra marathon. These are the same patterns we see in the general population. So even though athletes are kind of the super group as a subgroup, within the athlete group, there's an opportunity to handle pain, handle discomfort, recover from injuries better than others if you use the better or healthier coping strategies. Now, it's important also that we think about the impact of the sports environment on injured athletes. Right? So think about there's long-standing research on this, right? And this is something that we all probably just generally understand as well. Right, let's start with the long-standing research. The best type of support that you can get from the people around you is one that balances being too harsh and too pushy and too negative against a style that's too accommodating. Okay? A lot of times we don't realize that people who are too accommodating can actually hold us back because they start doing things for us. Oh, don't get off the couch because I'll do it for you. Right? When that happens, we miss an opportunity to push forward. So there's a balance there. So what we really need is we need a partner in the rehabilitation process. We need somebody who won't lag behind. They won't push us harder than they should be. We need somebody who will work with us as we move through the process. We push really hard for the idea that if you are injured, it would be good to have a caregiver or a family member involved in treatment with you so they understand what you should and shouldn't be doing so they can help you through the process. But in sport, then we get extra layers, right? Think about the sports culture. Injury is part of the game. You're supposed to tough it out as an athlete. If you don't push through this, you might lose the trust of your teammates, or you might lose playing time. And these then shape how we respond. Maybe we need to take a break. Maybe we need to do more rehabilitation. Maybe we need to skip one more game and come back in the next game so that we can last the rest of the season. But these pressures often push us away from what we should do to instead push us towards competing at all costs. So there's a balance there, and there's a balance to consider. So how do we then use pain psychology in the context of all of these pieces that I've laid out? How do we get the most out of rehabilitation? How do we get the most out of recovery? I want to go through just a few of those areas, and these are some of the key areas to think about. The first is to balance our sense that the pain or discomfort we're feeling is because of harm versus that it's something maybe that we should feel, that it's just discomfort, that it's okay, that we're not hurting ourselves. Pain itself is an alarm. It's an alarm that tells us that we're experiencing discomfort from something that may be threatening our body, may be threatening our well-being. It's an important alarm. If you're standing in the kitchen, you rest your hand on a hot burner, you want that alarm to go off so that you take your hand off the burner and you don't harm yourself more than you probably already did. But at some point in an injury recovery process, we no longer need that information. So if you've sprained your ankle, let's go with broken ankle. If you broke your ankle, in the early stages, it's important to know that it's painful so that you give yourself an opportunity to have the bone heal. As you go through the recovery process, though, and the bone has healed, if you're still having pain or discomfort, it may not be because that's broken. It may be because you haven't been using the leg. It may be because of weakness. It might be a sign of some other issue, but not that original broken bone issue. We often tell people, let pain be your guide, and that is absolutely correct when you need to rest and recover and allow something to heal. But as we push into rehabilitation, as we push back into functioning, a lot of times we start to feel discomfort and we're not sure if that's a real alarm or a false alarm. Heck, sometimes it's the case that rehabilitation is just uncomfortable. So here's the thing. It's important to work closely with your medical team to understand and evaluate how you should be perceiving the pain you're feeling at any time. And it's important to understand that that may evolve over time. A second area is focusing on function instead of pain. Like I just said, the pain signal is important. But when we feel pain, we change how we function. We change what we do and don't do, how we do it, how we go about things. When we change those behaviors, and then we get rid of pain, right? Either we've healed and it's gone away, or we take a pain medication, or we get an injection, or we have a surgery, the pain goes away. It doesn't just mean that we go back to functioning how we did before. because now we've learned new behaviors, new ways to use our body, new ways to act. So at minimum, when you're recovering from an injury, the approach needs to balance both the pain piece, treating the pain, treating how much it hurts, and the function piece, right? How we're moving our bodies, how we're using our bodies, how we're going about what we're doing. But there's also evidence actually that suggests maybe we should prioritize function. Let's make sure we're moving the right way, even when it's a little uncomfortable, because moving the right way will ultimately set us up the best way possible to improve our pain. So just like in the last piece where I said to understand the pain you're feeling at various points in the recovery process, it's important to work with your medical team. Here too, it's important to work with your team to know what the goals are. What is the goal of this piece of my rehabilitation? Is it to get rid of my pain? Or is it to help me function better? Having that context is really important. Third thing, let's talk about fear of re-injury. Pain, injury, these are really uncomfortable things. We would rather not experience them. It's uncomfortable and it's disrupting. It gets in the way of our life. If we've been injured, it's natural to fear having to face that again. We might have a setback or we might re-injure ourselves. And when we're afraid, we naturally become self-protective. And we know that when we're self-protective, this can limit recovery because we don't push forward. It also limit return to play because we might return to play in a cautious way that doesn't allow us to push ourselves to the limits the way we used to. Here, there's a balance that we need. The sport culture, like I said, is all about push, push, push. Like, how do we push forward? Fear of re-injury is all about holding you back. We don't want to push too hard, too early, against the advice of our medical team. But we also don't want to hold back simply because of fear when we could be pushing forward. Here too, having those goals, having that understanding of what you should and shouldn't be feeling about how hard you should or shouldn't push forward is, again, really critical to work on with your medical team to get the most out of your rehabilitation and get to that optimal space with your recovery. Now, the fourth thing I want to talk about is the part that, of course, I have to talk about as a psychologist, which is what is the role of the psychologist in this picture? I've talked about your medical team. I've talked about your rehab team. Where might you need a psychologist? Being injured, as I've said over and over today, is very disruptive. Getting knocked out of your sport, not getting to do the thing that you enjoy doing, developing some of these concerns like fears of re-injury, this can all be distressing. You might want to see a psychologist because you have mental health concerns, things like depression or low mood, or maybe you're feeling anxious. It's important to know that being depressed or being anxious are predictive of a slower or less successful recovery. In other words, this is something that can hold you back. You might want to see a psychologist also for injury-related concerns, like fear of re-injury, or because you always are jumping to those catastrophic thoughts and you know that that's not helping you. Or you might have performance-related concerns. How do you get back to competition successfully? How do you achieve those goals that you've been pushing so hard for? Sometimes it can be hard to find psychologists with this expertise. Most rehab teams, most team medical doctors know which psychologists in their area have this expertise. So it's important that you speak up to your medical team if you'd like to see a psychologist in your area. So let's wrap this all up and put all these pieces together. We started with the idea that pain, discomfort, and injury are a biopsychosocial phenomenon. It's not just an injury, right? It's something we experience internally, externally, something that we have to cope with. And how we cope with that challenge, how we cope with that injury, can have a huge impact on the outcomes, on how we heal, how we function, when we get back to sport. We talked about also the fact that while those rules I just stated apply for everybody, sport provides this unique cultural context. And we have thoughts, we have beliefs, we have understandings, we have pressures about being injured in the context of sport. We in the last section talked about the actionable pieces, how you can pay attention to your coping, can work with your providers to improve or address some of your concerns, and how you can even see a psychologist like myself to work through your injury successfully. Now, if what we talked about today interests you and you want to read more about this, we've written about this in 2 books that recently came out. I have no stake in these books, but I'll just put this out there in case you want to do more reading. Both of these are running focused books, but I think they could still be of interest. The book on the left, The Clinical Care of the Runner, is focused more for medical providers. The book on the right is focused on a broader audience. In both of those books, I had the opportunity to write a chapter on the psychology of injury, rehabilitation, and recovery. And so you can get a little bit deeper into these concepts in those books. My hope, of course, is that you'll be successful in pursuing your sports interests and pushing through your seasons and getting into your competitions without facing injury, without having to deal with pain, without having to deal with discomfort. But as I opened with, it's almost inevitable that at some point in a sports career, you will face some kind of challenge with your physical health. I'm hopeful that what we talked about today gives you some ideas of the things that you have to focus on and the opportunities to optimize them or get the most out of them so that you get back to your sport as efficiently and effectively as possible and can have more future success. Thank you.